Wonderful. So welcome to the group presentation for the Wendi Digital Assistant. My name is Marty. I'll be your presenter today. We're going to take a tour through Wendi, and Wendi is a platform that you could think of kind of like a front office in a box. She's going to include a patient engagement solution, which sits on your website, a customer relationship management or CRM system. She includes her own phone system with some automated telephony features, as well as the ability to run insurance benefits and schedule appointments based on the availability in your EHR or practice management system. So if you can imagine for a moment that this is the front page of your public-facing website, and I'm a prospective patient seeking treatment, the first thing that Wendi's going to do is pop up here on the right-hand side of the screen and introduce herself. She's going to ask if I'm a new patient or an existing patient. If I'm an existing patient, I can update my contact or insurance information. I can also cancel or reschedule an existing appointment. I'm going to go ahead and specify that I'm a new patient here. And so Wendi's going to ask me to fill out this patient inquiry form. This is the basic kind of bare minimum information that we need in order to create a record in the CRM system. So I'm just going to go ahead and fill this form out. But before I do, I just want to let everybody know on the call that I'm using a mental or behavioral health provider type for the demonstration today. But suffice to say, Wendi will work for all various types of providers. So whether you're an optometrist, dentist, whether you're a general practitioner, acupuncturist, urologist, or anything in between, Wendi will work for you and your practice needs. So I'm going to go ahead and just select here from the list of issues that this provider has made available to select. So I'm just going to select ADHD. It's at the top of the list. Click select, type in some birth date information, gender, and then the payment method. I'm going to select insurance because I want to show you the insurance verification piece. But if you accept other payment methods, you can specify those here. And Wendi will be able to let people know if you accept Medicaid or Medicare that that's an acceptable payment method. If you don't, Wendi will just let the patient know, sorry, we don't accept TRICARE, for example, but here's some other payment options for you. I'm going to go ahead and just type a phone number in here. And once I click submit, two things are going to happen. The first thing is Wendi's going to send a text message to this phone number. So that way, if I want to pick up the conversation with Wendi from my smartphone, I can do so. Otherwise, when I click submit, the other thing she's going to do is thank me for the information and let me know that this particular provider does in fact treat the issues for which I'm seeking treatment, in this case, ADHD, and then also might be able to set my insurance benefits. So to confirm whether or not my benefits are accepted, I'm just going to click into this benefits form. I'm going to fill out some more of my boss's information here. Wendi remembers the birth date because I gave that to her on the last form. Any information you give to Wendi, she'll remember, so you don't have to re-enter that information over and over again. And this, along with other optimizations that we've made, has helped to improve conversion rates off of baseline web traffic by as much as 40%. I'm going to specify this is a Blue Shield of California policy, and then pop in the member ID right here. And once I click submit, Wendi's going to start looking up the insurance benefits. Now she's connected to nearly 1,000 payers nationwide, which covers roughly 96% of the insurance market. And once she comes back with the return, she's going to be able to confirm whether or not my policy will cover treatment with this provider. And then is going to give me a one-sentence explanation as to what my policy means to me in layman's terms, relevant to my out-of-pocket responsibility. So you can see here she's come back with the return. It looks like my insurance will cover treatment with this particular provider. And then after I meet the remaining $300 of my deductible, I'm only going to be responsible for 35% of each session. So at this point, that sounds good to me. Wendi asks if I want to schedule my first appointment, and I'm going to click into the scheduling form to take care of that. So she's going to pre-populate all the information I've already given to her. So all I have to do is enter my email address here. So I'm going to go ahead and do that and click submit. This is going to pull up a calendar powered by Calendly, and this calendar can be pointed directly to the availability in your EHR or practice management system. So that way you can rest assured that when patients are booking appointments through Wendi, that they're not double booking with the previous slot that you have, or they're not booking dates and times for which you're not available. So I'm going to go ahead and just pick a date and time that happens to work best for me. Now, I can also type in my cell phone number here, and this way, not only will I get email reminders about the appointment, but I'll also get text message reminders sent to my smartphone as well. So this further alleviates your front desk staff from having to do additional follow-up in addition to scheduling the appointment itself. So at this point, I'm done. In just a couple of minutes, I've been able to get pre-qualified for treatment based on the issues I'm seeking treatment for, have my insurance benefits run and explain back to me in a way that I understand, as well as schedule an appointment based on the EHR availability for the provider, and make sure that I get email and text message reminders about the appointment. So if I go to the provider dashboard now, let me refresh the screen, I'll be able to show you how you can administer Wendi. And Wendy's available and accessible through any web browser, as you're going to see here today, but you can also install the We Recover app on your smartphone. So that way, if you have an Apple or Android device, you can have Wendi in your pocket or purse wherever you happen to be. So this is the record we just created. If I click into the SMS icon right here, Wendy's going to pull up the conversation we just had with her, but from Wendy's perspective. So I can add additional information right here. So bring your mask and ID, send that information over to the patient. I can also navigate to an intake form or other attachments or any other waivers that you might need people to fill out or sign. If you have any electronic documents, you can send the links along in this chat thread. And you can also utilize any of the forms that come pre-built with Wendi, or also snippets. And snippets you can kind of think of like email templates, but for text messages. So if you have a common message that you want to communicate over and over again, you can create a snippet for that. But you can also use snippets for the purposes of text message blasts. So rather than using a text line or a dedicated platform for that, you can use Wendi to be able to communicate messages en masse to different groups of your patients. So for example, if you had a waiting list and now you have a couple of open spots, you can create a snippet announcing that you now have availability and then send that message to everybody that's in your waiting list along with your scheduling form so they can schedule an appointment. Or if you wanted to notify people that you're now in network with a new HMO, you can go ahead and send a snippet to all of your active patients and include the insurance form so they can update their insurance information if they happen to have that HMO. So you can create not only individual messages with Wendi, but also optimize mass messages for communications with groups of your patients or prospects. You've probably noticed there's a phone number right here. This phone number is dedicated to the account that I'm working on right now. So if you are a new provider, you can use this phone number and publish that, and that can be your published line. If you have an existing phone number, you can either port that over to Wendi, or you can forward your phone system over to Wendi and then take advantage of the automation features that we have in the phone system. So if you're spending money on a phone system, like a Google Voice number or something like that, and you don't have a very complex call tree set up, then you can save some additional money by switching to Wendi. Otherwise, if you like your phone system, you can keep it, just forward your line over to Wendi. One of the interesting features we have is something called a missed call message. So a lot of providers really, if they pick up the phone during normal business hours, they can field a question. But if they're in session or they're seeing patients or it's after hours, they rely on their voicemail message to really be a catch-all for all communication. And while it sounds like a good idea on the surface, increasingly patients are unwilling to listen to voicemail messages that exceed 60 seconds or so. So if you have a voicemail message that's 2, 3, even 4 minutes long, you may be getting an increasing number of missed calls. And those missed calls are basically people that call and don't leave a voicemail and then hang up. So you don't know who they are, you don't know what they wanted, if they're a prospective patient or spam, and you really don't know how to help them. And so consequently, those are the least followed up on inquiries that are made to providers as well. So what we do in this instance is anytime somebody calls and doesn't leave a voicemail, Wendi will automatically send a text message to that phone number with a form for them to fill out. That way, it doesn't appear like you've missed the call at all. It actually appears like you're expediting a response. And then when they fill out that form, they can self-identify as a prospective patient as opposed to spam or anything else. So now you kind of move them down funnel automatically without having to take manual intervention. And then when they fill out that form, then you can go ahead and proceed with any follow-up that you might need to carry out. In addition to that, you can also make outbound phone calls, upload your contact list, dial out just like any other soft phone system. And because we don't charge for the phone system separately and there's no user or fees per clinician or per user, you can have all of your staff take advantage of the Wendi phone system and they can effectively have the app on their smartphone, and that can be your corporate phone system. Okay, so I'm going to click into this patient record that we created here today. All the information we provided to Wendi is in the information tab. And one quick little highlight is when you're communicating with patients, it appears like a text message to them, but it's really a secure bridge to SMS. So all the information that's stored in these forms here is fully encrypted and HIPAA compliant. So you don't have to worry about whether patient health information is stored properly. No information is ever stored on personal devices. It's always in the cloud on Amazon Web Services with the same level of security as the Pentagon. Now, all the information on the benefits are in the benefits tab. You can rerun benefits at any time. So if you say someone booked an appointment at the end of March, it's now the beginning of April, you can rerun that benefits check to ensure that their policy hasn't lapsed, they didn't forget to pay their premium or didn't switch jobs or something like that. You can scroll down and view the visual mode. And this allows you to track an individual's status towards completion for meeting deductibles, out-of-pocket maximums for individual, family, cost-sharing benefits for in-network and out-of-network benefits. You can also see co-pays, co-insurance, and Wendi will key off of these in-network or out-of-network parameters when communicating with patients. So if you remember, she mentioned that I had a 35% co-insurance, and so that's what this is keying off of right now in this particular policy that you're looking at. You can also see you can see limitations on the policy here for all the levels of care that are provided. And again, this is a mental and behavioral health insurance check relevant to this policy, but you're going to be getting a benefits check relevant to your particular practice needs based on your provider type. Okay. Now, in addition to the visual mode, you also get the HTML view. Now, this is going to be more granular detail and a visual representation as opposed to a visual representation of the data. So you can see I typed in Max here, but the actual subscriber name is Maximilian. So any variance between what I enter into Wendi and what's on the policy itself will be highlighted so that way you can investigate that further if you so choose. Your payer note is here, so if there's any state-specific restrictions in the policy, you can see what those are. And then all the benefits information is listed in granular detail in a text format down here towards the bottom. Okay. In addition to the benefits, you'll also be able to append notes to records, just like any other CRM system. So if you want to click into this note, you can just say, new policy 5121, call back to get new policy, new info. So I can save this. And now at the record, you see the note, you see that I made the note. So if you have different staff members that are going to be logging activities, you can see who spoke with the patient and when, and then there's a date and time stamp. So you can see exactly when the conversation took place and for how long. Calls and voicemails are tracked in the patient record as well for your convenience. So that way you don't have to sift through a general voicemail box or go back through Post-it notes or things like that. Now, we would do referrals two ways. And because Wendi is a HIPAA compliant and secure platform that you can access from any web browser and from your smartphone, it's a very convenient and secure way to send referrals. But it's also a very meaningful and actionable way to receive them as well. Because when you make a personal referral, all you have to do is type in the phone number, first and last name of the recipient to whom you want to send the referral. They don't have to be a paying customer. They don't have to sign up for anything or subscribe. Once they just confirm their contact information, they're going to not just get the name, number, and policy. They're going to be able to get all the information on this information tab here. They're going to be able to get all the details on the benefits through the benefits tab here, and any notes you may have appended in the notes field as well. So it's a much more complete referral to receive, ultimately helps the patient get to where they're going faster, and is very quick and easy for you to send with a mind towards security for the patient health information as well. Wendi can also facilitate referrals automatically. So for example, instead of ADHD, what if I selected that I was seeking treatment for Alzheimer's, for example, and this particular provider didn't treat Alzheimer's? Wendi could say, oh, sorry, we don't treat Alzheimer's, but here's 3 providers nearby you that do. So that way you and your staff don't have to worry about facilitating referrals based on general web traffic. You can go about your business. Wendi can handle those kinds of things and still make sure that you're helping the patient get to where they're going ultimately. Okay. In addition to that, there's just a couple of settings that I want to highlight for you. The availability and scheduling is where you're going to point Wendi to your EHR system's online booking system or calendar. So you can select your calendar provider from these list of options, but any other EHR or practice management system that allows for online booking of appointments, you just select other and then type in the URL or scheduling link here. Wendi will consume that availability and only expose the dates and times for which you have available spots to prospective patients or active patients at the time that they're booking the appointment. The other thing that I want to show you is the match criteria. There's 2 things to highlight here. One, this is where you select your provider type and the list of issues that you treat. So I'm just going to go ahead and scroll through for the recording purposes so you can see all of the different provider types that are supported by Wendi. Now, these labels are never exposed to patients, so if you refer to yourself slightly differently than we've listed here, you don't have to worry about that. It's really more important that the list items contained within them match with the services that you provide and the issues that you treat. And so you can present those list items 2 ways. You can have Wendi qualify and disqualify. So for example, let me select myself as an allergist, for example. I click in here. Now I can select all the issues that I treat as an allergist. If I leave any of these blank, Wendi is going to know that I don't provide services and I don't treat that particular issue. So let's say I don't treat eczema. So anytime somebody selects eczema, if I don't have that selected here, Wendy's going to say, oh, sorry, we don't treat eczema. And then she can optionally either let the patient know that someone will be in touch with me shortly, or can make a referral depending upon how you have things set up. Alternatively, if you want to only present the services that you do provide, you can just select this toggle right here, and you'll be presenting a curated list of only the services that you provide. So however you want to set that up, and you can work with our customer success team upon your onboarding session when you sign up for the 14-day free trial, and they'll be able to help you configure all of that at that time. The other thing you can do on the match criteria page is set your payment methods that you accept. So if you're a cash-only provider, you can indicate that here, bypass all the insurance questions. You don't have to worry about any of that. But if you happen to be in network with any HMOs, you can specify those here, and then Wendi will key off of the in-network rates when reviewing policies that match. If you accept Medicaid, you can specify the territories. If you have any gender or age specificity, for example, if you're a pediatrician or OBGYN, you can go ahead and specify the age range for patients that you treat, or change the genders over here, and then exclude policies at the bottom. The last thing I want to show you within the product is the Wendi settings. The Wendi settings are going to be the place where you update all of the text that is communicated to patients through Wendi, whether it's through the chat widget on your website, through automated text messages, or through the phone system's communication and automation features as well. So you can, if you remember, this is the first message that Wendi said to us. She introduced herself as a digital assistant. For example, if I wanted to delete the digital assistant part, now I can imply that she's a real person. If I wanted to change Wendy's name to Bob, I can go ahead and do that too. Or maybe I want to change the Wendy's name to the name of the front desk staff person to create some continuity. You can do whatever you want there in terms of your greeting messages and all of the messages that are created here within Wendi. This is that missed call message I highlighted earlier, where when somebody calls and doesn't leave a voicemail, this will be the text that they get in the corresponding form, which you can change if you'd like. And then we also have an incoming call message. So that way you can help direct people that call into your main line to utilize Wendi and self-serve, especially if it's a request that can be facilitated offline after hours without the need of your front desk staff. So a lot of our clients are using this, something to the effect of the following. Hi, thank you for calling the doctor today. If you're looking to schedule an appointment or update any of your information, please go to our website at website.com and interact with our digital assistant, Wendi. She'll be able to assist you 24/7, 365. If you have any other inquiries that need to be handled by our team during normal business hours, please press 1 to be connected with our team now. So it's a 60-second message, a little bit less. It allows you to bifurcate your traffic, so that way all the issues that Wendi can handle are off of the plate of your front desk staff, and then all the issues that go in and proceed to your inbound team are there and require a human being's effort and thought process. You also have your voicemail message here as well. And if you need Wendi to speak another language, she will do her best. Any text that you type in for the incoming call, for the voicemail message, she will read aloud in a female digitized voice. And as long as they're Arabic characters like French, English, Spanish, Italian, she will do her best to sound out those words and speak them when she's communicating. She's not going to have the greatest accent, but neither would I. But she will do her best, and all the text that you type in will also translate as well. So if you can type the text in a foreign language, you can also support that as well within Wendi. Okay, all the other messages are also customizable as well. So how you present the insurance benefits information, how you let people know that maybe they're not a match for your services, or that you want to refer them out someplace. All those messages are customizable here as well. Pricing for Wendi is very straightforward. It's all based on, we don't charge per clinician, we don't charge per user. So all of your staff members can take advantage of Wendi. We don't want to restrict your access to the platform based on pricing. We do use the clinician count at your practice as an approximation of your organization's size. And so that way we can gauge the relative value that you're expected to receive when you utilize Wendi. So if you have anywhere between 1 and 5 clinicians, all of the functionality that I've showed you here today and more is just going to cost $99 per month. If you have between 6 and 10 clinicians, it just goes to $199. 11 and 20 is $399, and any more than 20 clinicians just goes to $499 per month. Now we have a 14-day trial that's available. There's no risk or obligation associated with that. When you sign up for the 14-day trial, you need to confirm your credit card information up front. The only reason why we do that, there's 2 reasons really. One, we're going to be doing an onboarding session with you at no charge. So one of our customer success reps is going to install the Wendi widget on your website, configure the phone system to meet your specifications, train you and any staff members that might be interacting with Wendi, configure your Wendi settings, get your insurance benefits dialed in. All that work takes between generally 1 and 2 hours, and we can schedule that on consecutive days. Your trial doesn't start until the onboarding has been completed. And so we want to do that work up front so that way you have a smooth and seamless transition to utilizing Wendi. Everyone's been trained and knows how to use her, so that way you have the best possible experience during your trial period. If you're not happy with how Wendi's performing during your trial, you can contact customer success and let them know that you don't want to proceed. They'll go ahead and cancel your trial at the end of the 14 days and you'll never get charged a dime. But if you're satisfied with how Wendi's performing, and we think you will be, at the end of that 14 days, Wendi's just simply going to charge your card on file at the appropriate rate under a month-to-month agreement. So there's no annual contracts, there's no commitments of any kind. If you decide down the road that you want to cancel your subscription, you can cancel at any time and there's no cancellation fees or penalties. So you can kind of think of Wendi like an at-will employee. You pay her for as long as she works for you. If you need to let her go, there's no severance package to pay. So at this point, I'd like to turn things over to Q&A. So if you have any questions, I'd be happy to answer them for you now. Otherwise, if there's no questions on this call, then I'll walk you through the sign-up process and get you signed up for the 14-day free trial. So let me pause, stop the recording, and we can take some questions.